So, there's a huge new 10-year plan for the NHS on the table, and it's promising some really radical transformation. But, whenever we see a government reformed this big, we've got to ask a pretty critical question. What are the risks, and have we actually learned anything from the past? Let's dive in. And the vision is definitely ambitious. I mean, the plan is talking about some major shifts. They want to get rid of NHS England entirely to slash bureaucracy, create these brand new integrated health organizations that would manage the budget and care for a whole population. And, this is a big one, move the money and the focus away from hospitals and into local neighborhood health centers. The goal, of course, is a more efficient, community-first service. Okay, but here's the big question, right? With a change of this magnitude, is this a genuine step forward, or are we about to walk right into some very familiar, very painful mistakes? To figure that out, we really need to look at another, fairly recent and pretty cautionary tale. So to understand the risks, we're going to look back at the massive overhaul of the welfare system that kicked off more than a decade ago. And as you'll see, the parallels to this new NHS plan are, well, they're more than a little worrying. You see, the blueprint for that welfare reform had really similar goals to the new NHS plan. Simplify a tangled system, make it more efficient, and completely change how services are delivered. You had universal credit coming in. Then later, the rules got a lot tighter. And all the while, the whole administration of the system was being centralized into these far-off hubs. Now, this centralization created something the source material calls administrative distance. This is a really key concept. It's the huge disconnect that happens when the people making the decisions are moved miles and miles away from the communities they're actually affecting. You lose local context, you lose responsiveness, you kind of lose the human element. And as we're about to see, the consequences were profound. So what was the fallout? What actually happened on the ground? Well, the human cost of that administrative distance has been tracked, and the numbers, they tell a pretty devastating story, especially for the most vulnerable people in our society. Just look at this number. By 2025, we're looking at over 1.6 million children living in households affected by just one of these policies, the two-child limit. That is a massive number of kids exposed to serious financial and administrative chaos during the most important years of their lives. And this is where it gets really interesting, because this slide just shatters a common myth. When you actually look at who was affected, the majority, 59% of these households, were in work. This wasn't a policy just affecting the unemployed. This was a system that was failing working families. So that generation of kids who grew up under this new system, well, they're now teenagers. And the downstream impact is just staggering. Between 2017 and 2023, the rate of probable mental disorders among 17 to 19-year-olds more than doubled. That's not just a number. That is a full-blown public health crisis. And that crisis didn't just stay on paper. It flooded right into the NHS. From 2012 to 2022, right during the thick of these welfare changes, hospital admissions for kids in a mental health crisis jumped by 65%. A failure in one government system was creating a massive strain on another. And if you look at self-harm admissions among teenagers, it's the same. Just heartbreakingly grim story, a 37% increase over that decade. The instability and the hardship the system created were turning into real, measurable clinical harm. Okay, so the really crucial thing now is to understand how that system failed so badly. We need to connect the dots between what went wrong then and the potential risks of what's being proposed for the NHS now. One of the biggest red flags was in the decision-making process itself. As this quote points out, the unbelievable number of successful appeals wasn't just about a few random mistakes. It was a clear sign of a system that was fundamentally broken, getting things wrong over and over again. And this chart, wow, it just lays out the sheer scale of the problem. Towards the end of 2025, tribunals were overturning 67% of appeals for personal independence payments. For all Social Security appeals, it was 58%. Think about that. The system was getting it wrong more often than it was getting it right, and people had to go through long, stressful battles just to get the correct decision.
All right, so this slide puts it all side by side, and it's pretty chilling. On the left, you've got the proven failures from welfare reform, broken accountability, changes that had no evidence they'd work, and that toxic administrative distance. And on the right, the potential risks in the NHS plan. Abolishing NHS England could create new accountability black holes. New models are being pushed without any public safety case. Power is being centralized. The patterns, they're disturbingly similar.
So when you step back and look at the whole big picture, what you're really seeing is a major national risk in the making. This isn't just about tinkering with policy. This is about the basic principles of responsible government and protecting people from harm that we absolutely can't avoid. And this right here, this is the core warning of the whole analysis. When you reform a system in a way that pushes responsibility out of sight, when you create that administrative distance, you don't get rid of risk. You just make it unmanaged, untracked, and in the end, a hell of a lot more dangerous.
So, what's the big takeaway here? It's that huge reforms like this can have terrible, unintended consequences that can echo for years. The evidence from what went wrong before, that's not something we can just brush aside. It has to be the starting point for any new policy. Real accountability needs clear data, it needs public visibility. And just plowing ahead with another massive restructuring without learning these lessons is, as the source material says, administratively irresponsible.
Which leaves us with this final, absolutely critical question. When we're faced with these bold, ambitious plans for change, how do we, as a society, as citizens, make sure that those changes are built not just on grand promises, but on a solid foundation of evidence, of safety, and of the really hard lessons we've already learned?